YouTube, it's me. I'm here to give you my 38-week belly shot and update. Whew. There she is. I'll be talking about my external cephalic version, which caused a lot of bruising down below in the center, and then a lot of soreness up here. So that's what I'm talking about when I talk about my bruising. Okay, so last week was kind of exciting. I had my, external cephalic version, which is where they manually move the baby from the outside, and it was done under an epidural. And I have to tell you, I'm so grateful for the epidural. So I'll give you a little brief synopsis of the week, and then I'll go into more detail about the actual procedure. Had the ECV. I just had a midwife appointment this morning. It went very well. I'm actually in a very good place right now, so I feel okay. Yeah, so things are fine. Baby girl is healthy, moving constantly, kicking me in the bladder, and yeah, things are good. So let me go into what the ECV day looked like for me. I had to check in at 10 a.m. and then they monitored the baby right away. And they saw that she was moving perfectly fine. Then they wanted to get an IV started they needed to do 2 blood tests, so they drew blood from the IV site, and then they stuck the catheter in my wrist to give me fluids. And I asked them what the tests were. One was a CVC, I'm not sure what that means, and the other one was a type. And I said, well, I know what my blood type is. It's O positive. And she said, well, it doesn't matter. We're going to check it anyway. So we need 2 vials of blood. And I was like, that seems redundant. And I asked her, well, when I go into labor, if I don't go into labor today, if I go into labor, will I have to do this again? And she said, yeah, you will. And I was like, that seems weird and just so redundant, so repetitive. It doesn't make sense. So the first time she tried to put the IV in my left wrist, she hit something. Something that I've never felt before. It felt like pulsing and pain, like my insides were being stretched out, but my veins. And she said, oh, if it hurts that much, I probably hit a valve because I'm not actually getting blood out of this. And I was like, I don't know what that means, but it obviously doesn't work, and my wrist hurts. And she was like, I'm really sorry. You know, we usually have this policy where if you could try twice. If you don't get it, then you don't get any more tries. But I hurt you, and I'm going to get somebody else in here. She talked immediately about getting people in to do an ultrasound on my veins to see where my veins are, and then they would stick in the IV. And she's like, have you ever heard that you were a hard stick? And I had, but only at this hospital. So I told her no. I used to donate blood regularly. Every 64 days, I would donate blood. I used to, I would get my blood drawn. Dealing with infertility, you're constantly getting your blood drawn. So I've been getting my blood drawn perfectly fine everywhere else except for this hospital. So I said no. I haven't heard that I was a hard stick. So she called in another nurse on the floor, and the second nurse was like, I'm just going to look. And sure enough, she hit the vein in my right arm, got the 2 vials, put in the IV, good to go. So I was like, whew, that was over. That could have been a bigger ordeal, but that's over. So it turns out my nurse who was handling the vials mislabeled them. So the second nurse that came in to do the one blood draw and IV already had the IV taped in and fluid was going in. She said, you mislabeled them and the lab won't take them. You have to redraw. And she was kidding with me. She was like, plug your ears, you don't want to hear this. And I was like, I'm not going to plug my ears. What's going on? So she was like, sorry, we have to do this again. And then she called in a third nurse. She didn't even attempt the draw, my first nurse. So third nurse came in. She was, yeah, I told her she was difficult. Anyway, I told her my left wrist, it still aches a little bit, but I told her my left wrist hurt really bad, so please don't grab my wrist. So immediately she grabs my wrist and she's shaking my hand and slapping the top of my hand over and over again. She's shaking my arm and slapping my veins. I mean, it's weird. And she's standing right in front of me and she's talking to the other nurses like a normal person. And then when she talks to me, she like uses baby voices. You need to calm down. And I was like, I'm going to punch you in the face. This is great. So she tried my elbow and my friend said, she's not very good with blood and needles and stuff, but she watched this one. She's like, this one I'll watch. This is fine. And my husband has been watching the whole thing. And she saw them stab, miss it, stab, miss it, stab, miss it, bring it all the way out and in, out and in, out and in, over and over and over again in my elbow. And she was like, oh my God, this is terrible. And sure enough, this vein was blown. It was bleeding out. It was not good. Then she tried one of the two holes that's in my wrist, or in the back of my hand, and again, I could feel her taking it out, putting it back in. So she wasn't using, I think they're called butterfly needles, where they actually, once it's in, they move it around and they find the vein. She was using just a regular needle, I don't know what they're called, but sticking it in and out, in and out. And I had a big old gaping hole in my wrist, or in my hand, and blood pooled under my skin at the knuckle. And she was like, I'll try again. And apparently, I didn't hear any of this because I was like, please get away from me. And they were like, no, you can leave. And then when she was doing the hand one, it hurt incredibly. So I winced. I was all like that. And then she chastised me. She was like, you can't hold your breath. Don't hold your breath. And I was like, I'm in pain and I'm wincing, but whatever. I didn't say any of that because I'm just like mad at her. So I was either going to yell at her or I was going to cry. And after she did that and she was like, okay, I'm on my way out, she came back to me to be like, you need to relax. You need to do this. Your veins roll. You're blah, blah, blah. And I just started crying out of anger and frustration. And I was so mad. And I was like, this was supposed to be the easy part. So she got like half a vial maybe. And then the fourth nurse came in, different lady, and she poked me in the back of the hand, and she got half a vial of something, of blood, and then she left. And she was like, I guess we'll just have to do what we have to do. And I'm like, this test isn't important. I have my blood type on file with my OB. You guys, it was your mistake, not mine. So quit telling me that my veins roll, my veins are flat, my veins are, I'm a hard stick, whatever. So I think this sort of prepped me for if I have to go into labor and I need an IV, which I'm GBS positive, so I will need that. I'm going to ask them to do the ultrasound IV. And hopefully one stick, and that's all I need. So by this time, it was 12 o'clock. The anesthesiologist came in. She had prepped me about what the epidural was going to be like, and I had so much anxiety about the epidural. I had sleepless nights, and I was just like, I don't need an epidural. I'm going to do this labor naturally, and I don't need an epidural, and I'm not going to pay for an epidural. Like, I just got all weird. But then I was like, no, I'm going to get an epidural. My OB said that she had more success with an epidural. It relaxes you. You don't feel anything. I'm going to do the epidural. So she came in, funny, witty, awesome. The only thing that hurt was the lidocaine. She called it a bee sting to numb the back area. And then there were 2 shots of lidocaine, and I felt the first one, and I kind of jumped a little. And then the second one, didn't feel it at all. So that was great. Then she put in the needle, and I heard like a little popping sensation type deal, and she was like, oh, there it is. And then put in the catheter, took out the needle, and it was placed at 12:15. So that part, easy, awesome. They were waiting for it to sort of kick in, and I started, like, my legs felt tingly, but not like, I still move them. So I was like, yeah, this is great. And she was like, I'm going to give you the smallest dose ever because, you know, it's just for this version. You don't need it to be numbed completely everywhere. So small dose. So you'll probably just not feel your belly, but you're going to feel your legs. But my legs went completely numb, and I was laying on the bed with my feet out, and I couldn't move them. Couldn't move them closer together. Couldn't, like, scoot. I couldn't roll. I couldn't do anything. I was completely dependent on other people moving my body. So at 12:55, almost 1 p.m., they started the ECV. And they started it going towards my left, and they got a pretty her head was like in the middle of my belly, but the bottom, where I told you most of my bruising was, they were pushing and pushing and pushing, and her pelvis just stayed down in my pelvis. So yeah, she was comfortable there, she wasn't moving, and then my blood pressure dropped. And I started feeling kind of like, I kind of have to throw up. I kind of feel like I can't breathe. So I started, to me, I was laboring breathing, and I was feeling like gunk in my throat, like I was gonna throw up. But she sat me up and put something in my IV to stop the nausea, either Zofran, epinephrine, I'm not really sure exactly, to bring my heart rate up and to make me feel better. So that worked. So we took a little break then we went back, and I was sort of laying with my head below my stomach, so I was at an angle, like my head down here, my feet up here, and then, not that severe though. And then they tried the other side, so now she's trying on the right side, and I felt like the anesthesiologist was actually the one at the top of my belly pushing the head, and really it was the back of the neck that she was trying to push, and I could feel her going over the baby. Every time she would push to the right, it would just go over the baby. So I knew the right side was just not going to work out. And then my blood pressure dropped again. So they had to sit me up and give me another thing of whatever to make me feel better. And then they tried again on the left side. So all of this took about an hour, and my OB said that she would stop at 45 minutes, and usually they go within the first 10 minutes if they're going to go. So I knew that going into it, and so I was like, I'm going to be in and out of there in like no time at all. And then the IV issues. So I was like, this is taking forever. But then once she got to the ECV and it wasn't working, I was like, can you do this for longer? Which was funny, but like, yeah, it was pretty intense. So they monitored the baby throughout the whole thing, through ultrasound, through the electric, the non-stress test little nubs that go on your belly, and then they're strapped in by a band. My nurse would just hold it there when my blood pressure would drop to make sure that the baby was fine. So that was fine. They stopped at 2 p.m. She said, "I'm sorry, this didn't work. It was unsuccessful." Um, Baby was butt down instead of feet down, so her feet were kind of up and her butt was completely down at my cervix, and I cried. It was the second time I cried, but I just cried, and it was from disappointment and feeling like out of control. I'm gonna cry again anyway. So my OB was like, "Why are you crying? Are you okay?" And I was like, "Yeah, I'm just disappointed, and like I don't want a C-section, but that looks like something that's gonna happen." And she's like, "Well, you could either schedule a C-section or you could go into labor, and we'll check the baby's position then." And so I said, "Okay, I'm gonna do that last one and wait for my body to go into labor." And I'm praying that she flips right before I give birth. So anyway, so let's go back a little bit. They monitor the baby after the entire ECV, and they were like, "Lay on your left side. That's what you're supposed to do." And I know that I feel sick whenever I lay on my left side. I don't feel so good. And baby wasn't moving that much, and usually like they're checking heartbeat and they're checking movements, like big movements, small movements, everything. And she was doing small things, but she wasn't like super active like she should be. And she was like, "Well, let's try it on your right side." And I was like, I actually really enjoy laying on my right side to sleep. I feel more comfortable. I feel like she moves way more when I'm on my right side. And she was like, "Oh, okay, well, don't lay on your left side. Your body's telling you to like go to your right, so just go to your right." And that's fine. And so I was like, "Oh," because all the books are like, "Lay on your left side, do this." But everybody's anatomy is just a little different. And mine, my right side, she likes it, I like it, we're good. So it was 2 p.m. when they stopped. They monitored the baby. They finally got the right things that they wanted to see, and then the epidural. I was just waiting for the epidural to wear off. And from the time they stopped at 2 p.m. took 3 hours for the epidural to be out of my system enough that I could walk. Probably a little before that. I could walk, but they were still monitoring baby, and I was switching sides and stuff. But I tried to get up at 3 o'clock because they were like, "It should take about 40 minutes for you to be like fine." And I got up and my legs were a little shaky, and I kind of felt like, okay, I could walk, but my butt was completely numb. Couldn't feel it. I was all, "Nope, I don't feel it there." I know it's there, but I can't feel it at all. So she was like, "Lay back down, we'll check you in 15 minutes. But then we monitored baby, and then I got out of there at 5 p.m. So I spent 8 hours to do what I thought was going to be like a little morning routine, and then I was going to go have a big lunch because I couldn't eat anything. No, it was not that at all. So while she was doing the ECV, my OB said, "If you're close to delivering, I would probably start feeling contractions during your ECV," but I didn't feel any. So I think that baby is comfortable in there and has time to flip. Not that I actually think that she's going to flip, she said to me. And so I was like, that's not what I want to hear, shut up. I want to hear, "Yeah, I've seen crazier things. She might." But, you know, she's not going to sugarcoat it, and this is my first baby. So my uterus doesn't know that it has this ability to stretch. Yeah, so there was that. And then I heard through the grapevine that different doctors in the state of New Mexico would do breech vaginal deliveries if the butt was down. My midwife said if it was completely butt down and feet were up by its head, we knew that for sure, I could deliver you, I would deliver you, feel comfortable delivering you in the OR with an IV, with everybody there, with the OB there, with anesthesiologists ready to pump you full of drugs and get the baby out, because this is when it becomes a matter of minutes with the baby's life. So if all the stars align and she could get a team together and I go into labor at the right time and like all of this stuff, she would do a breech delivery. So I talked to her about that today, of course, but before I had called everywhere and I was like, I'm willing to drive like up to 2 hours to go anywhere if they would do a vaginal breech delivery. And some of them were like, no, that's unsafe. No, we don't do that. No. And then I looked on the ACOG, which is like the Association of Gynecology and Obstetricians, whatever, and they said that their official stance is it's up to the provider. They have limited teaching of vaginal breech deliveries because it's rare, and there are complications, so you have to be ready for them. So it's completely dependent on your provider. Yeah, so that's that. I'm still doing inversion, laying with my head down, butt up in the air. I'm doing moxa, where my husband and I recorded each separately a bedtime story that we've been reading from. I got him a Grimm fairy tale book, and so he read Snowdrop, which is Snow White. And then I was reading The Fountain of Fair Fortune, which is a Harry Potter fairy tale. And so we pre-recorded them, and when she's super active, we put the cell phone down at my lower belly and sort of move it around, and then we'll get a light, probably another cell phone or a flashlight, and sort of get her to sort of kick the light and get all excited by the light to hopefully entice her to move down. So, and I've been praying, and everybody I know has been praying that this baby will move. And I'm hoping, and that's all I can do. I can hope. I'm leaving it up to fate. I'm leaving it up to whoever. I talked to my midwife today, and she said, if you do have to get a C-section, I will be there. I'm not one of those midwives that's like, oh, C-section, surgery, I won't be there. No, she said that she's interested and she wants to be there, so that's good. She also said that if I need to go to a different city to deliver my second baby down the road, she said that I should go see this specific one, and it was actually one that I had before I moved here. So I was like, I know her, and that's great. And so, yeah, I'm actually very hopeful. I mean, my midwife and I cried. She said, sometimes you want what's best for your child, and you know what's best for her, and you can plan all you want, and then they make a decision, or they get stuck in an area, or and you could just see that it would be so much better if you would just do X, Y, and Z, and that's parenthood. And then I was like, please stop talking, I'm gonna cry. And I did, and then she did, and she held me, and it was great. So that was nice. I felt so supported from her, and I really like the fact that she's interested in being there and attending the C-section if I do need one. So alright, that's my 38-week update. I have talked you guys' ear off. I will talk to you guys later, and I hope you guys have a really good week. Bye! Hey YouTube, Anna here. So I got another package in the mail for my online baby shower, so I thought I would open it on camera, and I'll probably attach it to my week 38 update. So here goes nothing. Super excited. Oh, these are so cute. Enjoy your gift. Congratulations from Sarah. Thank you. Look at how cute these are. Oh my gosh. They're tiny little sleepers. I think they're in, 3 to 6 months. Perfect. Zip front, and they have little owls and flowers on them. That is so cute. Oh, thank you, Sarah. That was really sweet of you. Alright. I'm super excited to get everything washed and ready to go for the baby, could come really at any moment now. All right, thanks guys. Bye.